This is truly a very special occasion for us, not just because of the people we have on the stage, but because all of you are assembled here. We're here to talk about human capital, growth, and public policy. And you cannot think of a better panel to, I think, talk about this topic. I won't bore you with long introductions. Mr. Bill Gates. It was said of Tom Paine that he was introduced as, here's a person who lived for 2 revolutions. Mr. Gates has lived for changing the world at least twice over, if not many more times. Ireena Vittal, who's really one of the most dynamic leaders in industry, consultancy, I think sort of shepherding, I think, the corporate sector through innovative ideas in all kinds of ways. But also has written extensively on some of the most pressing public policy issues of our time around agriculture, urbanization. And Sanjeev Sanyal, who's really a Renaissance man, economist, historian, and now in the finance ministry. So let me begin with you, Mr. Gates. This morning you published an op-ed, a very powerful op-ed in the Times of India. Amongst other things, it of course made the case for the fact that India needs to pay attention to the development of its human capital. And the power of that argument came from the fact that, in effect, it was a call to arms in some ways, which is that if India can invest in its human capital rightly, there's no stopping India in some ways. That's something that's holding us back. You also mentioned very evocatively that India has been a second career for you in some ways, I think towards the end of that article. So if you were to look back on your second career, and if one were to ask this question, in looking back on that second career, what would you point to as the most promising thing about India when it comes to now taking forward this journey of human capital? And on the converse side, what is the thing that keeps you most awake at night about the second career? That here is an issue that you think is not being paid sufficiently attended to, or there isn't enough thinking around.
Well, India's at a pretty exciting point with huge potential. If you look and say in the world, what can we do to raise people up to middle income levels or reduce poverty? India's it, not only because it's 1.3 billion people, but because it has a dynamic democracy, it's got a lot of native talent, and so even the countries that are behind India will be looking to say, okay, how can you manage this feat? China, of course, for the last 20 years was the economic miracle. I mean, it's amazing. They are a middle-income country, and of course, we don't just want to look at economic figures, we want to look at equity as well. And although in terms of democracy they score very poorly, their focus on poverty reduction, on equity issues, actually has been very impressive. In fact, they have a plan to take the final 43 million that are very, very poor and use income policies and cash payments to solve that. So, in some ways they're a model, and in some ways they're not. But if India over the next 20 years can achieve a 7% average growth and do that in an equitable way, that's a miracle for the country and a miracle for the world. And I think we all want to help make that happen. The question of what are the enabling factors that might hold that back, something that should be talked about a lot. The two that I think are most prominent to me are education, which I'm not an expert in. Our foundation applauds everybody involved in that, but in India, we're not a player there. Health, including nutrition, is the area that we've spent 75% of our money, and even the other things we do, the agriculture, the sanitation, they're all but the digital money piece kind of ties back into this dream of good health. And definitely the Indian health picture is a glass half full. The improvements over the last 15 years, adopting new vaccines, the death rates have come down very substantially. and it's wonderful to have been a partner to a lot of those things that have had a very, very good effect. But the health levels relative to the income level already achieved is far lower than it should be, particularly in areas like nutrition. And maybe we made a mistake. We always talk about deaths, this many kids die, and that is a very important measure. But maybe we should have always put along with that the health of the living, because after all, now we have, even in India, 94% of kids do survive into adulthood. And yet a lot of these disease episodes and lack of nutrition are determinant in terms of their capacity. And we probably should do more work on mapping that numerically to the physical and mental capacities, and therefore what that economic effect is. But there's no doubt that all sorts of tests and things show that fixing these health problems, the cost of doing that can be very modest. Yes, it may involve going from 1.5% of GDP on public health to 3%, and it involves improving the quality of those systems. But if you take other economic miracles, like, well, all of them, mostly Asian, they all had that kind of, they lowered their malnutrition and they invested in health. And so, I'd say health is more on, people are talking, admitting that there's a malnutrition and a sanitation problem. I'd say the last several years, that's good. Now, we need to talk more about, okay, exactly what's missing. How do we solve that problem?
So you used an interesting word in your answer, which is India 7% growth, 8% growth. But you also used the word equitable. And we are sitting in Nehru Memorial Museum, and Jawaharlal Nehru has lots of faults. But Jawaharlal Nehru would say the following, I think, in partly response, that there are three conditions under which this formation of human capital, both on health and education, can take place. First, you need a capable state. Second, you need some commitment to equality, which is that highly inegalitarian societies where the social distances between castes and classes are so wide that the short answer is there isn't enough reciprocity. And this is not just true of India. As income inequality rises, you're seeing that argument happen in the United States. So you need at least some degree of inequality. And the third is you need an enlightened public culture where the joy over, let's say, jumping 30 ranks in the ease of doing business, which is a very important achievement in its own right, is really at least matched in fervor and ardor by the joy we would get if we jumped up in the HDI index, let's say even 5 points. And some would looking at India and say, look, India doesn't have any of those three conditions, right? What we are doing is a sort of band-aid job in the absence of those basic political conditions that make for successful human capital formation, as was the case in East Asia and China. Just wondering, since you've looked at all of these systems in their totality, how might you respond to that pessimism or skepticism about India?
Well, I'm more optimistic than that. Governments are always very imperfect, but the primary healthcare system has improved very substantially. We do a lot of our work in Uttar Pradesh and Bihar. When we got going, Bihar had less than 20% vaccine coverage rate. We haven't achieved perfection, but we're up over 75%, and that maps very directly to lives saved and to the health of the survivors being substantially better. And so, government, today India's like 18% of GDP is collected in tax. As the economy grows, of course, you get GDP to grow, so that's more resources. And most countries go from more like the 18% up to more like 30%. And so you get a huge set of resources because you're getting that percentage growing and that GDP growth. And so if government is smart, then the education quality and the health quality can grow fantastically. You know, the role of the private sector, you know, I would disagree with Nehru if he was here on that one thing. But government, you know, his three conditions are absolutely right. And we can't let the fact that those things are so imperfect today make us pessimistic. You know, India has improved dramatically, and you have to start with that as the, you know, the basis. We all wake up every day, you know, well, see the smog, or, you know, look at the statistics, but there are things to build on. You know, some of the states have gotten serious about malnutrition. The standards on food fortification, now we've finally gotten engaged on that. It's a little too bad that the health is mostly in the headlines where, you know, there's a cluster of deaths or something like that. Turning that into a systematic focus on, you know, why aren't the jobs filled? You know, why isn't the coverage there? That's always tricky because the, you know, news likes this one kind of negative event. And that's partly why people's overall view of the progress is way short of what's actually taking place. So without being, you know, complacent about it, you have to say, you know, what has worked so well over the last 5 years? You know, take NHRM. Thank goodness NHRM was done. If they didn't do that, the health spending would have fallen as a percentage of GDP, which is outrageous. And you know, some of that money actually was very well spent. You know, lives have been saved through that money at about $1,000 per life saved, even though some of the money was not spent well, and, you know, that gives us room for improvement. So I do think India has most of the elements that are of interest. You know, education, which is how you understand. Why isn't it improved more? You know, sometimes that is a little discouraging, where you say, what the heck?
Right.
You know, why did China, Japan, Taiwan, Korea, you know, they made the teaching into a real profession. They made the healthcare into a real profession. Now, the digital miracle will let us track who's not there. It'll let us get feedback. You know, is your teacher good? You know, do they engage you in the subject? Did your, you know, healthcare worker show up when you were pregnant or not? So the quality measures on government education, the idea that we'll be able to see that and demand higher quality, I think that's one of the positive things that will enable some of these improvements.
Right. Thanks for this. So just kind of you know, continuing in this line of inquiry, one of the, so you rightly pointed out that I think that there is a public perception that the state doesn't function. In part, that public perception is a function of our public cultures of representation in media, right? The negative stories get more play than positive stories. But when citizens see the state itself dependent on philanthropy for its core functions, does it in the long run increase their confidence in the state and whet their appetite to pay more taxes to the state? Or does it, or is there a possibility that under some circumstances, while that might give us short-term wins, it actually corrodes the legitimacy of the state or the confidence people have in the state? I mean, again, you've been engaged with this question, I know it, but given that this is a state placed in the context of democracy, and in the end, a sustainable system will require that allegiance, what do you think the public-private partnership does to, in a sense, people's confidence and the democratic legitimacy of the state?
Well, I wish philanthropy was so big that we could actually take over some of these things. Philanthropy in the US is 2% of the economy. In India, it's not 0.2% of the economy. And so the role of philanthropy better be some super narrow role. You know, one thing that's systemic is that helping out the poorest, the private sector isn't going to focus on that. So for example, the regulations to make payment banks work, that we invested tens of millions of dollars in terms of, helping consultants come in, and hopefully that becomes an enabling element. Encouraging a new rotavirus vaccine, which Raj Baum was the inventor, and we funded. Now Bharat makes at a very low price this new vaccine. Those are things that are philanthropy that, yes, if government was totally enlightened, they might have done those things. But funding pilots, how do you train teachers better? How do you organize schools in a different way? What's the best curriculum? Departments of education don't do much R&D, and they're very stuck with the status quo. And so philanthropists can shake things up. They can bring IQ in, they can bring better measurement in, but they are never, philanthropy is never the thing that is the long-term funder of the basic rights of the people, which include health and education. And Indian philanthropy, I think, will grow by 4 or 5 times. And I'm not just speaking about billionaires. I'm talking about very broadly. It can be a growth part of the economy, but it'll still be very, very, very tiny. And so the resources and the legitimacy for the long-term behavior in health and education, that is the state. And we don't do anything that isn't in partnership with the state. Yes, if I wanted short-term gains in Bihar vaccine coverage, we could have hired a bunch of people and done it in a side program. But then even I can't afford to do that on an ongoing basis, and it doesn't build capacity. So philanthropy, the hard thing about it is that in most of its programs, it has to help build state capacity. And getting that partnership right, making sure that philanthropy is not overreaching in terms of its role. Yes, criticize us if you see something you think we shouldn't be doing. But we are tiny. So one problem you can't complain about is that we're going to take on these big problems.
You're being a little modest. I mean, I think you're tiny in relation to the overall economy, but some would argue that not tiny in relation to the ability to change discourse and set standards in these particular areas of activity, particularly because these are areas which the state has abdicated. It wouldn't matter as much if the state had actually taken them seriously in the first place. That's often, in a sense, I think the nature of that argument. To put it provocatively, some people argue governments are happy to partner with philanthropists. They aren't happy to partner with their own people.
We haven't taken over any state thing. I mean, India had not introduced any new vaccines for a long time. And that's clearly a state function to decide because the medical standards and the long-term affordability and the delivery system, that's very much a government thing. And so it's fair to say, did we prod, and write studies and, have expertise saying, yes, you should adopt these new vaccines. But at the end of the day, the government's representatives met, and that's a very sacred decision because once you, decide to do that, you shouldn't withdraw. You should understand that you can deliver it and you can finance it and things like that. And, so that makes perfect sense. The payment bank, the Reserve Bank of India, which is quite a competent group of people, it was up to them to decide what these payment bank regulations, and they didn't have as much money to study that question and go, how did it work in Kenya? What went wrong? What went well? We can encourage that. Even the vaccine coverage, we've been able to bring in very smart numeric people to help measure where is this system falling down. So, it's strange. I guess, I'm a tiny bit less cynical about government than you are. And, and yes, it's definitely a glass half full. But, here we are, and look at, 10 years ago versus where we are today. There are very few negative trends. One of the problems of democracy is the name of the game is for politicians to say the other politicians are idiots. So, every time you pick up the neighborhood, this politician is saying this guy's an idiot. So, who talks about the progress? Do people know that the childhood death rate has gone down as much as it has? Or, as bad as nutrition is, There are exemplars in the country. This Food Safety Board is done exactly the right thing. So, you know, let me cheer you up. You know, we can prod it, but it is going to be key. You know, the economic miracles, those governments really played their role very, very well. And, you know, underfinancing health, okay. You know, I'm saying that, you know, if democratically people decide that's a priority, I think that will accelerate the economic miracle.
Thank you for your candor. Sanjeev, to turn a little bit to education, some says you're now in the finance ministry, and so in a sense, two questions, right? One is, why aren't allocations to health and education going up in relation to the scale of the challenges we face? They are going up, partly with the good things happening, right? And give us a sense of when you prioritize, right? Where do these two things fit in that scale of priorities? And second, what do we need to do differently in education, right? If you to kind of think of what is the paradigm shift that India needs to sort of, you know, make in education, what comes to your mind?
So let me begin by saying that I'm very sympathetic to the idea that we should spend more on health and education. You just need to tell me what I should cut down on. Should we have less electricity or roads or even defense? I mean, given our neighborhood, we need to spend on that as well. So it is not an easy task to make these choices. In the end, what we have to do is simply to collect more taxes and have more resources in our disposal. And of course, as you know, we have taken this massive jump into the new taxation system, the GST, which will hopefully not just change the collection of indirect taxes and make it more efficient, but also give us paper trails, et cetera, to be able to tax the rest of the economy. And of course, hopefully with the economy growing, we'll be able to get more resources. So I think growing the cake at this stage of our development has got to be the main strategy rather than trying to figure out how to divide it better. Now, going on to your other question, which is about what to do about education. Obviously, we need to invest more in basic education. I mean, that goes without saying. So I'm not saying anything particularly new about that. But I think when it comes to tertiary education or even parts of secondary education, it's much more tricky. Because whether we take skills or university education, we happen to be building out this infrastructure at a time when knowledge itself is changing very, very quickly. We also have another problem, which of course is not our own problem only, the worldwide problem, is that demographics is changing also very fast, and people are living a lot longer than anybody imagined. So remember, we are building infrastructure today. This sort of infrastructure hangs around for generations once you build it. And the usual way we are building this infrastructure is the way education infrastructure worldwide is built, in fact, is that you basically educate yourself till somewhere in your early 20s and then live off that for the rest of your life. Now, most people in this room will live to somewhere around 80. In fact, it's quite likely that my children's generation will live into their 90s. Now, the problem is that no pension system in the world is going to allow us to retire at 60. Certainly not my generation. So we'll be working till 70. So if we get educated till our early 20s and work till 70, that's a half a century of a career. And essentially, we have only been, by the time I'm sort of at the second half of my career, almost all my skills are outdated. And yet, all education systems around the world are set up to give you education in the beginning and then nothing else for the rest of the time. So we need to begin to think about our skilling and our university systems completely differently. We can have maybe some revolutionary ideas, like maybe technical degrees should have a sell-by date. Or maybe we should completely rethink the way we build universities. I mean, today, the way we think about universities is, you finish high school, you leave home, you go and study in this university. Very often the universities we build these days, post-independence, are these sort of campus towns away from the city. And what we think is that, you go there, you study, and that education is somewhat separate from daily life. And then when you leave that campus, you never ever go back to the campus again. Whereas this may not be a tenable plan at all going forward. Since I think it should be normal to keep updating your knowledge through your life, particularly after 20, 30 years of having worked. That doesn't mean that you may be in a position to leave your job and go back, but because university life should be a part of normal careers. Now that means that we should build our universities bang in the middle of the city, rather than far away in campuses. We need to, I'm just giving a few examples of this, and I would love to hear what Mr. Gates thinks about this particular issue, because obviously technology will play a very important part in all of this.
Mr. Gates, you've written about and spoken about the challenge of technology for the future of education and employment. Somewhat pessimistically, actually, on that front. But for a country like India in particular, is there a critical choice that you think we need to make in thinking about the relationship between technology, education, and employment that we are perhaps not thinking enough about?
Well, the quality of the education system, sometimes depends on, are you optimizing for the teachers or are you optimizing for the students? And it's interesting that the U.S. is not, some wonderful exemplar. Our education is good relative to what we put into it. We should be a lot better. And we have equity problems because the cost of the tertiary education is going up a lot. That's the system that I know quite well. Technology so far has not had a broad impact on education. Yes, there's wonderful stories of how people like us can go on and watch lectures, and maybe 1 or 2% of the smart kids really use these things, but it hasn't hit the mainstream yet. I'm a big optimist about that. Here in India, Anil and Connie's working on this X step. It's early days, but I think it's fairly promising that that will play a role and help quite a bit. I will say, getting the GST passed was a huge, fantastic thing in terms of internal distortions and the opportunity over time, as it's digitized, to raise the compliance rate with taxes in general. Digitization, whether it's digital money, attributed digital money like the payment bank structure, will be an ally in terms of broad tax collection, and therefore the perception that it's fair, and then the sense that people should pay their fair share. I think all those things will trend in a positive direction and give the government a chance. How quickly digital technology will get into the K through 12, the younger student arena, and make a big difference, it's hard to predict, because I've been over-optimistic about that many times, but I'm still very, very much a believer.
Sorry to keep you waiting. You worked in such a variety of sectors, right? Both in the social side and the private sector. As you look at India's human capital story, right, where do you think the deficit is being felt the most? Which sector? What keeps you awake about our human capital story?
I often think about the case for human capital for India. Yeah. And the reason is because if you think about our human capital, it should be treated the way we treat spectrum or coal or one of the other resources. And we know we don't do that. We know that the case for the living is particularly difficult, because we don't really understand that if you're not healthy, you have attention deficit. And if you're not skilled, then you have a long-term challenge, not just with income, but with confidence and with dreaming. And I'm a student of cities. How do you make Indian cities inclusive and livable? And I'm a student of agriculture. How do you make agriculture a viable business? And I just want to tell you the story of one theme that comes up across both of these, which is water. If you look at the story of Indian water, it's a fascinating story. We might actually go to war for water, in addition to data. And there are many layers to it. We know that we have a problem with quantity. We must be the only large economy in the world whose finance minister and farmer wait and pray hard for 3 months of the year. Otherwise, our interest rates would get affected. We must be the only big country in the world which has 2 large cities like Chennai and Bombay flooded, and the Kosi River making so many of our Bihari citizens poor every couple of years. And at the same time, we have drought, right? So we have an issue with quantity. We have an issue with quality. There's arsenic in our water. There's uranium found in our Punjab water because we've gone so down into groundwater. And of course, we have a problem with equity. Now, the good news about the Indian water story is we have the answers. We have enough intelligent people, and we've done enough great work. And the answers come, it's not easy, but it's solvable. We need to do treaties with China and Pakistan, and we need to do them now. We need to do treaties between our states so that war doesn't become rampant. We need to look at agriculture, which is 86% of water consumption, and we need to decide what to grow where. And we need to decide how we use technology to identify water flows and build little bunds and little storage capacities, because we have 1/3 storage capacity that China has. And most importantly, we need communities to create water user groups and change incentives so that different castes and people who are rich and poor come together and share water, because the water might be beneath my farm, but it belongs to everybody. And in urban India, we just need to repair and put in technology to transport water, to meter water. We need to recycle. You know, the power guys use a lot of water, and we need to think about how do we price it. So the solution to all of this is known. And why doesn't it happen? Yeah. It doesn't happen because of human capital. If you think about execution, and I think the golden word in India is execution, because we have to think about reimagining the system and executing, whether it's in water or in cities or in agriculture or in education and health. But if you think about reimagining and execution, who is the leader who owns the water problem? And I look at a central government, and we have a Ministry of Drinking Water and Sanitation, and we have a Ministry of River Rejuvenation and Water Resources. And neither of them looks at water management. They look at supply and quality. I look at our institutions. We have a wonderful CWC, a Center Water Commission, created in 1945, and a groundwater entity created in 1970. Great engineers, both of them do water projects. Nobody does integrated water management. We need 1.5 million people who work in our villages, in our cities, 1.5 million, using technology to build aquifers, changing incentives. We don't have those people. And if we wanted to fix this, we have 7,900 cities, we don't have mayors. Now, who's going to take a decision on pricing of water unless it's a political leader? So to me, the real issue in our human capital is we don't think of it, I think, as capital. But if we only changed our mindset and realized that India's answers lie in execution and in reimagining all of our systems, and that will need people. And for that, we need to make sure that they have skills, they are educated, they are healthy, so that they can focus on this. It's our mindset that I worry the most about, right? We worry about coal and spectrum, but I wish we would worry about 1.3 million resources. Each of them is valuable.
So Mr. Gates, in your second career, what is the most remarkable execution story that you have seen in India, that you're personally touched by, that you say, look, this is the kind of execution that gives you hope that India can do it?
Well, I'll start with the very first big project we did in India, which was called Avahan, which was to make sure that the HIV epidemic didn't get into large numbers in India like it had in Thailand and many places in Africa. And so our primary measure was making sure that the commercial sex workers didn't get so highly infected that then you would get this general epidemic. And our tactic was to create communities of health workers, places they could come, talk to each other, save, and that then they would trust each other to insist on safe practice, and that by getting a critical mass, that would make a difference. It was very successful on this primary thing. actually the benefits were probably even larger in that they would talk about violence and exploitation and getting out of that field of work, and the community was kind of an amazing thing. Very touching to go in and hear the stories. I think I cried every time I visited one of those. And it's also a story where the Indian government did, not perfectly, but quite well take, and that has maintained itself. So, there's heroes who went out and created those things. People in the community, essentially, because it was only the peers that they would listen to and trust. You couldn't do enough billboards or pamphlets to make one iota of difference in that case. So that idea of, okay, you got to build a community, now a new analog of that at larger scale is how to use the self-help groups to both report on bad healthcare supply, or we're not involved, but bad education supply, and to learn, okay, you need to do exclusive breastfeeding, you need to get your kids vaccinated. And there's some very hopeful figures that have come out of getting into these self-help groups, and that's all before we have advanced cell phone technology, which is kind of the next generation of what we want to do. So, another example is the supply chain for vaccines, which was really a mess. That's gotten improved so dramatically. It's fantastic. They're actually saving money on not buying too much and having to throw it away because the supply chain is fixed. In today's digital world, you think, well, isn't that easy? No, actually, there was 5 years of hard work, and some states are still implementing it. But there are so many positive stories, and this event is a reminder that we mostly just talk about, like, okay, nutrition. This is a sad story, feel bad, please feel really bad so that we do something about it. But maybe I don't tell why I'm so excited about what we're doing in India. And it is for us a model of what we're going to go and do in places that, you think your government's bad, go to Africa. Democracy that you have here, even though it wavers a lot, it generally tends in the right direction, which is why things like the educational progress being slow still puzzles me a little bit.
So one last question before we open it up to the audience. Ireena used a word sort of systems and systems management. And of course, India's tax over GDP ratio is low. We are still a low income country. But one of the big debates in India is really about what should be the architecture of our health system, right? Public, private, insurance-based. And some people feel that right now we are kind of trying to tick off all boxes, right? So literally any intervention or any architecture into design you want, we have it. We are doing private insurance, we are strengthening the public system. If you were to look 15, 20 years ahead, what trajectories do you think India should go down on in thinking about a basic architecture for the health system? US, Canadian, British, or whatever, something totally different. But what framework should guide our architectural choice in thinking about health?
No, don't look at the US.
Yes, exactly.
We have so much money, we get to do really crazy things. I mean, we spend about 18% of GDP on health, and no one else is even close to that. There are lots of middle-income countries, Turkey, Brazil, Thailand, and the basic architecture is pretty clear. There are the very basic things having to do with vaccines and pregnancy that should be the public health system, and there the quality can go up, and sort of doubling the GDP for those basic things, the percent up from the sort of 1.3 that it is today. When you get to this growing burden of non-communicable diseases, the idea that it's going to be purely public sector, that is not the best approach. The best approach is that the government somehow causes the insurance markets to get to critical mass, and then a set of private providers come along who compete on their cost and quality of providing those services. You know, I remember I was in Bihar once and somebody put a slide up saying we're going to do every disease, you know, in the public health system, and I was, you know, because that's so unachievable and not really the right architecture. I was worried. Fortunately, that person left a few minutes later, not because of me. And so the biggest growth has got to come from the private providers being reimbursed by large-scale insurance plans. And so today the government's involved in a lot of subscale stuff, studying what these other countries have done, piloting some things. You know, this is an area where you know, our foundation in a small way wants to help, you know, all the right studies get done, because it is so important, and we don't think you can scale just the free health service to all of the health challenges that lie ahead.
Sanjeev, you want to come in this, and then Ireena?
To bring some attention to an issue that very often slips people's minds, that in the end, the most important ingredient into better health is actually better drains rather than better hospitals. In India, this is a serious issue. Public health as a general is really held down first and foremost by the quality of municipal management. This is what drives, you know, too many mosquitoes, the spread of diseases, and so on. So I think while we do discuss the vaccines and so on, very, very important, I do think it is very important to remember that basic municipal services are an extremely important part of improving quality of life and health. And in fact, since the Industrial Revolution, some people have estimated something like the 2/3 of the benefit of better health comes from better drains rather than better hospitals. So in this debate, while I agree that maybe Mr. Gates may not want to get involved in our municipal governance issues, but I do want to remind everybody else that has got to be the place where we need to work hardest.
Well, I hope you'll become an advocate of an improved 74th Amendment. Ireena, Ireena, any thoughts on this question of systems?
Well, let me just have a thing. The sanitation really ties the water and drains issue together. And the problem's not solved, but the government's to be applauded that it's got visibility, it's got some funding. You know, India's not going to be able to afford to put clean water piping and sewage piping back out. So really looking at innovation will be necessary to get this thing scaled up, both processing the sewage that's there so that it's not dumped, and then eventually having a toilet that ideally can burn up the sewage, the waste, so that it doesn't have to be handled in a very complex way. It's only a small percentage of the water usage, but in terms of the quality of life and disease, it's a very important thing.
Ireena, any thoughts on this?
I would agree with the construct that Mr. Gates has laid out. My only other thought is there are enough models out there, and I think India is unique because of the scale, but it's not so unique because it's actually a combination of many topologies, and it would do us good to understand what works in different countries and then think of India as a series of clusters and just implement it. So it's not going to be rocket science, but it does require careful design, which comes back to human capital.
Great. You've been very patient. I'm sure many of you are, you know, lots and lots of questions. So we'll just open it up briefly for a few minutes. If you could keep your question brief and pointed. I think Junaid, you have a question? Yes, sir.
Thank you. Good evening. You know, I having worked in India for on and off for 10 years, this whole issue of state capability is without any doubt one of the most challenging stories. And Ireena, I think your point of clusters, I think India's future lies in how strong its federalism will be. because the innovations and competitions among states, I think, will drive the change in state capability. So my bet is not on 74th Amendment, my bet is on strong states, and then I hope for 74th Amendment. The question I had for the panel is, in infrastructure, we're seeing a lot of leveraging of private markets to get finances into infrastructure. The question is there a counterpart for human development in health and in education? And we're seeing the rise, or at least the discussion, of social impact bonds. And we're seeing interesting discussions emerging whether you can have livelihood bonds, education bonds, and the social impact bonds, and whether the corporate social responsibility funds can be used for that, and whether philanthropy can also do that. Is the rise of this debate about social impact bonds a future for funding health and education?
The actual scale of social impact bonds today is totally tiny, like a rounding error. In some ways, it's the state paying for things, but through a cleverly designed incentive system. So for example, in the US, if you take prisoners and you try and help them go back to society, you can get a payment based on the recidivism, how many of them end back in jail. Now, designing these things and having these delayed rewards that I worry that people expect more from that than is likely to happen. In infrastructure, electricity, if you collect bills properly, airports, railroad, there are some types of infrastructure that work that way. Surprisingly, a lot of things related to roads and water, it's been very tough. There's no country where the road infrastructure is substantially private sector funded. And even where it has, usually there's defaults that take place because the politicians don't like the toll roads building up. So I think we can be more creative, but there's some things that will remain public goods.
Yeah, please.
With the first company or NGO in the world which has raised a social impact bond for education. And we have now 2 million girls in Rajasthan and Madhya Pradesh who were out of school, who are now in school and doing very well. But I agree with Mr. Gates. I think it's the cherry on top of the icing of the cake, because even this entity works through the state schools and literally works with those teachers and makes them better, and works with the community and changes their mindset about girls going to school. So I think at the end of the day, it's a public good, and it's the state's responsibility. I think social impact bonds can again serve the same role that the philanthropy does, which is to catalyze. But if you think of this, it has to continue for hundreds of years, and that has to be capacity at the state level.
Yes, do you want to say something else? Okay.
The other panelists, I mean, yes, you can use CSR and other things as the cherry, but on the cake. But in the end, the bulk has to come from old-fashioned financing, frankly, let's not hide away from that. So I think we can use some of these innovations, but so far at least none of them in the world seem to have really replaced the old-fashioned way of financing these things. Maybe it'll come, maybe we'll innovate something, but I am not aware of anything that would do it.
Yeah, even the Indian CSR thing, I would view as an experiment. The impact per dollar of that money, as a few years go by here, we should really look and see, if the state had just collected that in tax versus left. It's not clear. No, there is no country that's actually done it that way. So it might or might not work out well. At the very least, I think you'll find cases where it's low impact today.
So I've already seen about 20 hands. I was trying to keep track. We won't be able to get more than 3 or 4 in, unfortunately, although hopefully there'll be sort of time later to discuss. So Yamini?
I wanted to learn a little bit more about knowledge, not in terms of how you change the world, but what should be the instrumentality? Is it supporting institutions? Is it about supporting knowledge building? Is it about supporting the state? What should be the instrumentality? And from your experience, what are the conditions under which these different kinds of things may work?
Well, the great hits of philanthropy include things like the Green Revolution, where Rockefeller and Ford Foundation financed seed improvements where India was a huge beneficiary. That is, instead of there being starvation in the late 60s and 70s, in fact, calories per person went up despite the large population increases. And some academics, had predicted that, so that was a super positive thing. The easiest thing for philanthropy is knowledge, public goods, inventing a malaria vaccine or an HIV vaccine. The thing that we wish philanthropy was good at, and sometimes it is and isn't, is helping delivery systems work better, helping teacher training work better, helping healthcare worker tracking work better. And most of the specific money we spend in the country is to try and help these delivery systems work more effectively. And you can't solve all the problems just by inventing new things, even though I love that part of it. So helping fix, doing pilot models to help delivery systems and understanding how those get back into the government so that it can be scaled, that to me is the top thing. Now that, philanthropy's got so much variety. There's people who do museums, there's people who do, orphanages, there's lots of great things. But for large-scale social problems, helping the government delivery system improve is probably the most important thing.
Meenakshi, ma'am.
My question to Mr. Gates is actually twofold. I wanted to ask, in terms of philanthropy, how much percentage of your foundation money India is recipient of? And secondly, what motivates you to work in India? Why India?
It's a good story.
Well, I love the work we do in India. India is the country we spend the most on by a huge amount. Yeah. Now, it's 1.3 billion people, some of whom are malnourished and not getting vaccines. And so if you want to improve the world in a dramatic way, you better come here to India. And, our team in India is a fantastic team. And I mentioned that, a lot we learn here has applicability to Africa. If you take Africa as a whole, we spend slightly more than we spend in India. And over time, as India, does better in a 10 or 15-year time frame, we'll spend, as you get out into there, we'll spend less. Most donors have already backed down. So, foreign aid is not a huge, I still love what's there, but it's percentage-wise, it's very small. So, when we see progress, that motivates us. We have a lot of money to spend, and so we're going to go spend it where we can see impact, and a lot of that's in India. As a percent, it's hard to say because a lot of things we do are like inventing the rotavirus vaccine, which is beneficial in India, but also beneficial in other developing countries as well. That Bharat vaccine is being used through Gavi funding all over the world. So of our country-specific money, I'd say about a third of it goes here to India, and I'd say we've gotten really good results out of what we've done, which is why it's growing every year.
Since the mic is here, Rajiv, and then I'll come to the middle final round.
Along with the other experiments that you would, with your foundation would actually try out, one of the things that I would suggest is actually the human capital angle. You're investing in health improvement and things of that sort, but we need people out there in the villages as health promoters, perhaps. People who can spread awareness, who can track what's going on, and hold the state accountable. So far, the people that we do have in the villages are often ASHA workers or A&Ms, people like that, who are part of the government system at a very, very low level and with very little compensation or training. So maybe some kind of experiment where you seed a bunch of people who will go out there in the context of non-communicable diseases. We really need promotion of healthcare awareness and exercise and whatever else as well. So something like that, where you actually, and this is for a country where we're worried about job creation, this is absolutely another angle that could set the trend for more and more change, high impact by investing in people who will go out there and do it.
Yeah, one of the greatest successes we've had as a foundation is our progress in polio. India had its last case of polio in 2011. And that required, there's a government agency that had to be built called the National Polio Surveillance Program, which was a very high quality set of people. And those people, some of whom are still there and now working on other diseases, like they're key to the quality of getting these neglected tropical diseases solved, where there's a lot of great things going on. But that institution, because it was so good, whether it's at our foundation or other health actors, it's been a source of incredible talent. So polio did lead to that. Another thing we invested in, the PHFI, hasn't scaled as much as we hoped for and is in some financial difficulty now. But we are trying to create talent at the grassroots level that includes the type of training and help that we think the digital system can do. For agriculture, it's a thing called digital green that we keep refining and improving its work quite well. For health workers, it'll be as we get the cell phone. We have 60,000 Agamanis now who have that, and we're seeing good results and constantly improving it. And we're hoping to scale it up to not just the Agamanis, which is 1.4 million, but all the different health workers that are out there. So it's a very good point. The training element, including the top level people who study other countries and the field people, that it fits this human capital thing super well.
So there are lots and lots of questions. Unfortunately, we can take only two, and we'll probably just collect them in the interest of time. We'll take them from the middle section, Dr. Shaival Gupta and Rohini Somnathan.
I have two quick questions. One, is development possible without institutional reform? China, in spite of lacking democracy, could leapfrog because of institutional reform. In India, we don't have, number one. Number 2 point, in India, wherever institutional reform has taken place, there has been much better endowment as far as health and education is concerned. But in eastern part of the country, where you have been working, institutional reform has not taken place. And last very quick question, that will it be possible to leapfrog India to the 4th industrial revolution? We are already undergoing the 3rd industrial revolution. And you are one of the architects of the 3rd industrial revolution. What we are going to have for the 4th industrial revolution without a very strong human capital in the country?
Lots of questions, so maybe you want to address.
Well, different countries progress in different order in terms of how they improve things. A lot of countries with strong non-democratic central governments improve a lot, and then they get to a certain level of wealth, and then they become democratic. Taiwan, South Korea were not democratic during most of their development. I'm not recommending that, but it's just a fact. China is the extreme case where they've gotten to a true middle income level, and yet they're not democratic, and that a lot of people are concerned about, appropriately about that. We work in Africa. Governments like Ethiopia and Rwanda are improving their health. Those are two of the best. They don't get a high score in democracy, and so you hope that everybody who gets to middle income improves both the health and democracy. India's an exemplar in that you got democracy at a very low income level, and it led to caste-based politics and all sorts of complexities, but it's basically a huge strength of the country to avoid things being managed in the wrong way. The word reform is, I don't know what the word means, honestly. Whoever wants to change something, picks that word. And any ideas people have on how we can accelerate, Uttar Pradesh achieving Kerala type health statistics, we are super interested in any way that we can drive that. There is a lot of change. People have been willing to make change. The whole OSHA worker thing is delivery in facilities. The progress there has been fantastic. Now the way they're compensated is distorting things, so now we need to, I guess you would say, reform that and bring a digital tracking system in so that it's done very well.
Last question, Rohini.
So this is both to Mr. Gates and Mr. Sanyal. I've spent a lot of my research life working on health and education, and yet today, and especially these days, I just feel that environment is the most urgent public health problem, even though I don't know very much about it. And so the foundation has been doing very little work on it so far. And is that because you feel that you'd like to focus on things that you can change the most relatively quickly? And I just wanted you to rethink that a little bit, because I think that there are a lot of things on the environment front that can be changed relatively quickly in India. So a question and a comment. And for Mr. Sanyal, this just responding to where the money is going to come from. And of course, we're going to grow. But also, we've had huge savings in things like electricity. And I think the state recognizes this and has had a role to play in it. The cost of solar power is 20 or 30% what it was just a few years ago, wind power, and the state is promoting this. But there are savings there, and I've just been continually frustrated by the attitude of state officials on the environment. So just a plea for rethinking that.
Well, just in terms of power, today if you want 24-hour power, the cheapest power is coal power. And yes, that has terrible environmental problems in the short run and the long run. But the intermittency of these sources, yes, power can be very cheap when the sun is shining, but people still want the hospital to work. So it's a very tough problem. I invest billions of dollars, not through the foundation, but personally in energy breakthroughs. And it was great that India committed to double its energy research budget at the Paris Climate Accords. Prime Minister Modi was a key person driving what, actually he picked the name, Mission Innovation. We got 30 countries to sign on to that. So there's a lot of work to do, but changing the transport system, changing the electricity system, those are private markets. And to have the right kind of startup and risk-taking and capital, foundations can do the advocacy to say, hey, we should have standards for emissions, and we should, to the degree we can push for renewable energy, we should. The advocacy piece can be philanthropy, but the actual technology of a system at scale like that is very much a private sector thing. There are great environmental philanthropists who are getting countries to put aside parks and to have fishing rules, and so it is an area ripe for philanthropy. It's just not our expertise. Climate change in particular, I care immensely about, and I spend a lot of time on it. We are going to face, even if we do the right things, a lot of warming, and so these improved seeds, including high technology seeds, may be necessary to keep nutrition levels high. But the environment's important. Other than sanitation, we are not focused there, and I'm glad that many other people are.
So just to respond, the government is very serious about the environment issue. And of course, there's enormous, as you may already be aware, enormous efforts being made to introduce non-conventional energy sources, particularly solar. But as Mr. Gates pointed out, it is not yet the case that we can store this energy for those when we need it, because they are intermittent sources. With this event would be much more difficult to do if we were relying entirely on solar, because we are doing it at night. The storage technology isn't yet up to speed yet. But enormous investments are being made, but trade-offs, as you can see, trade-offs have to be made. Coal does and will play a role for the near future, and we have to be prepared for that. So there are trade-offs that we will make, and hope that technology, in hopefully not too much time, will catch up with that. But by the way, environment is not just about the energy piece. There are many elements to it. Water was discussed. There's also a very major issue that we have to grapple with, which is rapid urbanization. And that is a big challenge and an opportunity. Within a generation, India will be an urban majority country, whether we like it or not. And this means that we are literally going to build new cities, dramatically expand existing cities, and so on. And the way we manage this process is a very large part of the game, because in some ways, these new cities will lock us into a certain environmental energy regime. So how we think about this particular issue is absolutely critical, and we are spending a lot of thought on it, incidentally. And some point early next year, we will have a new national urban policy that will be put forward, and you will see some of these ideas in there.
So I'm afraid we have to bring it to a close. We could go on for a very long time. Personally wanted to thank the panelists for their clarity, candor, and most importantly, the hope they have ignited.